Good morning. There are lots of questions about why a Medicare for All system is better than any other option on the table, and I'd like to answer those questions now. I'm going to start by saying that there is no other option that works and no piecemeal solution that will save us. I have an opponent who is proposing a system that, when analyzed, is little more than a vouchering program, enriching corporations, including nonprofits, with no trickle down to the actual patients or healthcare workers who heal them. In fact, the whole mechanism was proposed by a conservative think tank in the first place. The irony is that it's becoming accepted even amongst conservatives that the only way through is a Medicare for All system. What we know is the best healthcare systems treat healthcare as a human right and a public good. Our present system is financially unstable in every way, and it costs lives in addition to how much money it costs. And when we really want to know what's right, what can work, we must look to the nurses. Look to our nurses, including NISNA, who are on the front lines fighting for single payer, for Medicare for all, because they know one thing: a single payer system saves money. It will keep hospitals open for care, and it's the only way to put patients before profits. Healthcare justice crosses over into every realm of inequity and inequality, and allows us to stand against the forces that stand between Americans and our healthcare. It is the biggest, most profitable industry in the history of capitalism, and it is a giant failure, generating profits that we, the people, will never see, but are being harmed by and even killed by. We need to do what we actually can do to solve the healthcare crisis, and our best strategy is to present something worth fighting for. We are already paying for universal comprehensive health care, but we aren't getting it. And an interesting fact is that Medicare was implemented in less than a year as an entirely new system before we even had computers. There are other options to Medicare for All, and here are some of the reasons why we do not want them. Under the best circumstances, we would only achieve 85% coverage. The effort of creating a system to buy into is the same as Medicare for All, but it would benefit fewer people. A public plan becomes a high-risk pool, attracting those with the greatest health needs. They don't solve the other problems with the health system, like underinsurance, administrative complexities, and the enormous copays and deductibles that we're all paying. And employers, they want out of health insurance. And if we get them out of the health insurance business, it would be a win for workers and unions, as we would then get to concentrate on wages and safety. These types of programs continue an imbalanced system based on ability to pay. Imagine not being allowed to get well unless you're wealthy. Why create a new plan which becomes a high-risk pool, is more complex, with less savings, and includes private insurance? It's just absurd. These piecemeal ideas create the same barriers with copays and deductibles. And what about complexities? Do you even understand how your health insurance works? Because I don't. What it covers, and what about how much you have to pay? Nobody understands their health insurance. And as for just lowering the age as a patchwork idea, it increases the complexities for employers. It requires more tax on younger workers without benefits. As age gets lower, new plans would have to be created for maternity and pediatrics. It shrinks the private insurance pool, raising premiums for anyone who keeps private insurance. It realizes none of the costs savings of a single payer. It continues the complications of the current system and the uninsured and the underinsured. It would just look like a fix to the ACA. If we just look at fixing the ACA, we are still fooling ourselves. Every moment, the best pieces of the ACA are under attack, under a threat of repeal, just like the pre-existing conditions protection. Private insurers in the US are investor-owned and have managed to avoid regulations. It would force people to buy into a shoddy product that still leaves them unable to afford healthcare. Just like many people today, it gives more public dollars to private insurers for the poorest while they get to maximize their profits and heal fewer people. That's our tax money, and lives aren't getting saved. Commercial health insurance is a financial service, not a public service. Even for nonprofits, the money streams in from charging people the highest premiums possible, shifting as much of the burden of cost onto the patient, who they call consumers, as if this is a shopping spree and restricting payment for as many things as they can possibly restrict. Healthcare can no longer be treated as a commodity. It must be a public service, a public good. When we treat healthcare as a consumer-driven item, people don't want to pay for more than they need, or they feel ripped off. That applies to people, patients, and small business owners. We have had plenty of half-step approaches over time, and they all lead to disaster. We have no alternatives other than to implement Medicare for all now. The US now spends twice as much on healthcare per person per year than the average industrial nations with universal plans, and we still have 27 million uninsured and tens of millions underinsured. We are wasting $600 billion each year in paperwork and admin costs and in the overpayment of pharmaceuticals. This is more than enough to offset what it will take to get coverage to everyone without them having to have copays or deductibles. We are paying more and sacrificing people's lives just to get profits for health insurance and other medical industries. We are paying more. Anything less than universal coverage begs the question of who should be dying and who should remain sick just to keep healthcare profitable for private companies or to keep people in office. In the end, people are more important than corporate profits. It is time to stop tying the well-being of children to the employment of their parents. It is time to end the association between the companies we work for and our bodies and health. It is time to finally say no to using our public money to subsidize private industries. Our firefighters get to save lives without thinking about whether the people that they are serving are employed or sick or worthy. It's what we need in our healthcare system, and it is what we have to have and can have. We all deserve quality care without worry. We can do this in solidarity, and we will do this here and now. I want to run with you and for you and to you from this house in Staten Island to Washington, folks. I want to see our district thrive, privatize nothing, and publicize the truth. Let's run together from here to Capitol Hill. Thank you.